Watch more programs like this on cable and stream with PCN Select. Subscribe at PCNTV.com.
We're joined today by Dr. Thomas Farley, Philadelphia's health commissioner, as Philadelphia is scheduled to join the green phase of reopening on July 3rd. City officials announced earlier in the week that there would be some restrictions on this. How will Philadelphia's green phase look different from perhaps the green phase in other counties of the state?
Well, we're concerned about rising case rates across the country and across the region, and some rises here in Philadelphia. We were declining, but now we're starting to go in the wrong direction. So because of that, we are not allowing restaurants to have indoor dining, and we're not allowing gyms and fitness centers to restart, because those are sites where we feel like there's a possibility for a spread.
In recent weeks, you've expressed concerns about the caseload plateauing or perhaps even increasing. Is there any way to determine why those numbers are increasing, whether it may be to some extent due to increased testing, can it be drawn to any of the recent protests or community spread? How do you tell where that comes from?
Yeah, the increase in cases is not just due to increased testing, because we're also seeing an increase in the percentage of people who have tested who are positive. I can say that of the increases, it appears to be tilted towards younger people, people in their teenage years or in their 20 years. And we hear anecdotally about social events that these people have attended. So we are concerned that this is being spread in parties, and in bars and restaurants, certain matters with travel. And we know that other states have opened up bars and restaurants, and so this connects us to the increased cases around the country. So that's what makes us particularly concerned.
Recently, Allegheny County had issued an on-site alcohol consumption ban. Do you think that that's an appropriate response to their increasing caseload?
It is an appropriate response. They definitely are seeing a big increase in cases. It started at a lower number than us, but the increase is big. I'm wondering whether it's enough, though. I still worry about restaurants. In restaurants, people can't wear masks because they're eating and drinking, of course, and tend to be close together. And so restaurants are a site for spread as well. So it's not just people drinking, it's also people eating.
As the number of cases are increasing, do you see a correlation with the number of hospitalizations or the mortality rates? Are those being affected similarly?
So far, we're not seeing any impact on severe disease because these new cases appear to be mainly young people who tend to do well. And also there's a lag between when people get the infection and when they might need hospitalization and when they die. However, we're not given any sense of security the fact that these new cases are young, because inevitably some of them are going to bring it home and pass it on to their parents or grandparents. So we do expect we are going to see cases in more vulnerable people as a follow-up to what's happening now.
Masks are now mandatory in Philadelphia. How are residents responding?
Most are responding pretty, positively to the idea. I don't have any hard numbers for you on how effective the mask order has been. I can say we did collect some data before we put in place the mask order. We found that 55% of Philadelphia residents who were in transit stations, that's indoor transit stations, were wearing masks, and 78% of people exiting stores wearing masks. So that means the majority of people are doing the right thing, but still not enough. We'd like to be well above 80%. So we're hoping that the mask order will get us at a higher percentage.
How compliant have businesses been during the yellow phase of restrictions?
We are sending staff out to the businesses right now. In general, I'm hearing they're well received. I don't have any hard data on that. Certainly, it's not been complaints about the restrictions. I think most businesses are happy to be open at all.
Are there characteristics that perhaps differentiate Philadelphia from other parts of the state that require a higher level of vigilance among residents?
Absolutely. So we're the biggest city in the state. We've had the highest case count. We've had the highest case rate since the beginning of the epidemic. And we have, it's a high population density, a high poverty rate. So lots of reasons why Philadelphia would be uniquely at risk for this, which is why we think we need to be extra careful here.
As some restrictions continue to lift and residents might be considering vacations or broadening their social circles, once again, what recommendations would you make?
Right now, we're telling people to avoid going to the shore, which is what a lot of people want to do, because it does seem to be that these new cases are associated with travel, particularly to shore locations and social events there. So we know people want to get out over the July 4th holiday. This is not the time to do it.
Dr. Thomas Farley, thank you very much for joining us today.
Thank you.
We're joined today by State Representative Gary Day. You chair the House Aging and Older Adult Services Committee, which has held a number of meetings in recent weeks looking at long-term care facilities and how those residents could best be protected from the coronavirus. What issues most jumped out at you at these meetings?
Well, it was a virus that took us all kind of off guard, right? So I had a chance to watch the administration react on the fly, as this was unfolding. So I always tried to take a position. I thought it was important that the committee have weekly meetings, informational meetings, to just talk about things that people were asking questions about. And I was hoping that it was helping to form Pennsylvania policy going forward with the governor under the executive orders that he was issuing to our long-term care facilities and other, our assisted living facilities, the Secretary of Health issuing to hospitals, the relationship between when someone goes from a hospital to the long-term care facility, were all things that were, unfolding nationally as well as right here in Pennsylvania. So it was just interesting to be on that front seat and take a responsibility, take the responsibility on as the chairman. What do we need to be doing? And that's what we did. And that's what we have been doing, trying to have these informational meetings. This summer, we're working on, in July and August here, the committee is working on some of the main issues that need to be addressed. I've been trying to think about the governor and the secretary have been doing what we need to be doing now while we're still in the throes of this epidemic. But I've been thinking about policy-wise, what should we be doing with a resurgence or with another infectious disease?
According to the Department of Health, our senior populations have experienced the most fatalities due to COVID-19. What do you think makes residents of the long-term care facilities particularly vulnerable?
Well, there's a couple of things that make them vulnerable. First, your age, right? Your body is not in the physical condition to be able to fight off an attack from an infectious disease or viruses or any kind of attack like that. So getting your body into good health is a good idea. And that's part one, the individual and just the age. Your lungs could be less strong and vibrant to be able to fend off an infectious disease, and also the living conditions, being cohabitating in the same facility and having workers that are circulating among those people are the connection between those people.
How readily available has personal protective equipment been in these facilities?
Well, you know what, that was probably, there's two main things that we're working on to be ready for future increases or another infectious disease. One is PPE, and that's the personal protective equipment that you asked about. What we found ourselves in the case of is, I believe if we would have had the availability of PPE early, sorry about that, I apologize for that. I started off every meeting saying, turn off your cell phone, and now I didn't do it for your interview. I apologize. But the PPE being available for the workers, those workers that are circulating in the long-term care facilities among different residents, if they had physical protections, PPE is a mask, a gown, gloves, and the face shield. If we had that on them earlier, we might have infected one less person and caused that chain of infection to be lower and the spread slower. So having PPE is important. There's three things that I'm working on. When you try to solve a problem, there's three different things that I've identified that we could work on. One is onshore manufacturing of PPE here in Pennsylvania. So I have a bill to do that. The second thing that you layer on top, hopefully that would solve the problem. The secondary thing would be create a stockpile in Pennsylvania. There's a way to do a replenishing stockpile, and we have to take that through the legislative process. I have legislation for that as well. And the third thing, we had UPS Global come in, a person in my district, that I've known for many years, probably over 20 years, works for UPS Global. They told me about when you're sourcing, when you're buying from, let's say if we were buying from China, had the manufacturers for PPE, well, as they were way ahead of us, they weren't going to send PPE to the United States to prevent it. They needed the PPE there. So it caused a problem. And the sourcing, if we would have imagined 3 different places in the world that you can get PPE from, and using a smart logistical model for that, and using a company like UPS Global or one of our other great logistics companies, would create that 3rd layer. Those 3 layers, I believe, is how Pennsylvania should be going forward. Solve the problem with any one of those 3, put all 3 together and in place, and we should be able to answer the question, if this happens again, will we have PPE available? Put these 3 things in place, and the answer, I believe, would be yes.
You're also sponsoring a bill that would partially reimburse long-term care facilities for the purchase of PPE. Can you talk about that?
Yeah, you know what happened is, as I was working on what I just talked about, there were bills coming through the legislature that talked about PPE, dollars for PPE, for just giving dollars to purchase PPE. That's much more of a handle what's going on right now. And what I wanted to do is I wanted to elevate nursing, long-term care, and nursing facilities to that higher level of needing assistance for PPE. I think distribution is important. Our truckers and other people distributing food in particular, but all goods and services, food throughout the Commonwealth. I think our food producers are up there. And I think these long-term care workers and even residents and visitors, I wanted to elevate them up there. So we had that bill, we passed it through to put into that pact to give the intention of the legislature that is the first tier that should be protected and remain, open and working during that essential business period, should we go through it again.
The Wolf administration called on all residents and staff of long-term care facilities to be tested for COVID-19 by July 24th. Do you have any sense of how well that's progressing at this time?
The direct answer to that question, I don't have an update right now. I know that the facilities are saying, that the orders come out and the orders are asking to accomplish something in too short of a period of time. So they're talking to me about, can you communicate with us to the administration and say we need a little more time to comply. So that's one thing I know. Testing is vital. So I'm thrilled to hear we had an informational meeting. The governor came out and talked about testing a couple days before our informational hearing was scheduled on a Thursday. The following Tuesday is when Secretary Levine came out and said, we are going to mandate universal testing, what you talked about. And that's good, but there's something even better. It's called pooled testing, and it's exactly what it sounds like. You take 5 samples, you pool them together, you test that. If it comes up negative, you have 1 test to find out that there are 5 negatives. I think, everybody's familiar with that bell curve of going up in the number of cases in the Commonwealth and then coming down the other side. And I think the pooled testing would be very efficient at the beginning and at the end when the cases are lower. As the cases increase, the efficiency or the economic viability probably goes closer to 0 savings with pooled testing. So it's more valuable at the beginning and the end of the curve. But pooled testing is something I'm really encouraging the administration to embrace. We had a hearing about pooled testing it was either 2 weeks ago or 3 weeks ago. I'm trying to think of what today is. I think it was 3 weeks ago. And just within the last 4 or 5 days, Dr. Fauci at the national level has started talking about pooled testing as well. So not saying that he learned from our hearing, but just saying I was proud to, have that issue out there, because pooled testing along with mathematical sampling of who you test, say for colleges that are going back to school in the fall, maybe even public schools in the fall. And testing helps to identify where exactly is the enemy, where is this virus, and then we can, as a community, work together.
For those that may not be familiar, can you just talk briefly about what the current protocol is for inspections of long-term care facilities and whether you envision that changing as a result of the pandemic?
So I definitely think it should change. I haven't come to the conclusion of what should change yet. There are some things. I do have another bill out that I put out there about nurse staff minimums and just staffing minimums to increase the minimum required. If we do that, then we should be prepared also to increase the reimbursement for Medicare and Medicaid to our long-term care facilities. We shouldn't just mandate things on them and then require them to find the revenue when there isn't any from the part that we pay for. So you have to consider that. I think one of the other interesting things is that the long-term care facilities have reported to me, and they did this even before COVID, but really since COVID, it's even more of an impact. They're probably one of the most regulated agencies or industries, I should say. And the other interesting thing is there's 2 and 3 different bodies that they have to work with as far as being inspected by for different purposes. So I'd like to, and this might be a longer term goal, not the short term immediate triage fix for being in the middle of COVID, but at some point we should do a one-stop shop type of analysis where they're reporting to the federal government, they're reporting to the Department of Health at Pennsylvania, the Department of Aging at Pennsylvania, and the Department of Human Services at Pennsylvania. At minimum, we should be able to pull that together into one type of report and then require that the government mines the data that they need off of that. So that's a technological fix, but it's moving toward work. I've done this before in local government in Allentown, our 3rd largest city in Pennsylvania, where we made a couple government agencies come together and make it easier for the customer at that point, the person, the entity that's regulated. And I think we need to do that. So it's quite a big, the inspections it's very important. It's quite a big subject matter. I always think of you're going to inspect people for these items, and I think we need to go over those. I think we need to understand where were we with infectious disease and where do we need to be.
We only have about 2 minutes left. As chair of the House Aging and Older Adult Services Committee, what do you hope to accomplish moving forward to further protect our seniors from the coronavirus?
So there's one of the things I'm trying to do is just protecting seniors in general. We had a full agenda ready to go. We were going to have my first meeting as chairman. I think it was on the 17th of March, and it was that day or the day before that the governor, really closed down Pennsylvania. And I'd like to try to still do 1 or 2 of those other bills that protect seniors. One is with the people that are, senior abuse of seniors and the people that are allowed to work with seniors. There's a big bill, House Bill 1930, that we're actually working on, trying to see if we can get that passed next week. We're back in session. And there's another thing about guardianship, and those are people who would help seniors that become unable to do their own books, business, writing checks, things like that. And we need to do a little bit work there. With COVID, I think it's a 2-step, really a 3-step approach probably. One is make sure that we're never out of PPE for workers, residents, and I think also visitors. The second thing is to make sure that we do testing where we can find where the enemy is, the virus, who has it, who doesn't, and do it in an economical way, not just do it. The third thing would be the inspections, going through and making sure that what the Commonwealth is looking for is indeed protocols that will keep seniors safe.
Representative Gary Day, thank you very much for joining us today.
Thank you so much, and I appreciate the mission of PCN and everything that you guys do. It's really great to get information out to people in Pennsylvania, and I urge everybody watching this video, contact me or contact your own state representative with any issues that you have. You make them a better state representative by telling them what you think about issues you saw in this video and anything else to do with Pennsylvania. I'm State Representative Gary Day. Thanks for having me. I appreciate it.
We're joined today by Kristen Cronin. She's an assistant professor of public health at Muhlenberg College. There was a recent Spotlight PA article that focused on contact tracing, and in particular, they looked at instances where an individual either tested positive and declined sharing with their contacts, or somebody was identified as a contact and declined responding to inquiries. Why do you think this happens?
First of all, that's really concerning because contact tracing is really the best public health tool we have right now for stopping the spread of this disease. But there are reasons why some people might feel uncomfortable sharing who they've been with. Maybe they don't want anybody to know who they've been with. Maybe they feel like they might be, ratting somebody out. Or maybe the person who's being contacted just doesn't want to comply with what they're being asked to do.
Do you think there's a stigma being attached in any way to the coronavirus?
There's always a stigma attached to a disease. I mean, we've seen that through history with any pandemic disease. So I don't think this one is any different. It might not be as big of a stigma as some other diseases, but it seems like there might be some trepidation in actually notifying people that you're positive with COVID, even though there's nothing you could have done about it.
Do you think that the suggested 14-day quarantine also plays a role perhaps in some people's unwillingness to participate or to be identified?
Yeah, I mean, 14 days seems like a lot to ask of people, but in reality, it's not that much time. It's 2 weeks. We're asking you to just stay isolated from, others so that you can't spread that disease. Some people might be inconvenienced by that. Some people might want to go to a wedding or go to work or, not stop their everyday activities. This is a voluntary process, and you have to get buy-in from people to actually understand that it's sort of their individual responsibility to do this to help stop the spread of this disease. And if that means a little bit of sacrifice on our part by waiting 14 days to go back out, then, I think that's a reasonable ask.
Some people have concerns about what happens with their privacy, their personal information. What happens if whether you're identified as a contact or you test positive, where does that information go?
So we have federal laws in this country that prevent us from sharing health information with anybody unless we've got permission to do so. We can't violate those laws no matter what it's for. And so the person who tests positive, their identity is never disclosed. It can't be. And even to the contacts, if a contact says, well, who was I with? You can't say. And so that should be not a concern. With the people who are contacted, they are asked, obviously they've been given this name by somebody who tested positive. So, that information is, on the contact tracer's radar, but it's not published anywhere. Nobody else has access to that information. And so once the contact tracer contacts the person who's been exposed or potentially been exposed, that information stops there.
Some people may not have heard of contact tracing before the coronavirus became a pandemic, particularly in Pennsylvania. Can you point to other instances where perhaps contact tracing worked successfully? Contact
tracing has been around for decades. Like I said at the top, the big tool that we have in epidemiology to stop the spread of disease. And so as far back as smallpox, when we were trying to stop the spread of smallpox and actually eradicate it, it was because we were able to do such a great job contact tracing and getting to those potential exposed people, and then those exposed people did what they were supposed to do and didn't go out and spread the disease further. And then moving from smallpox, we've had definitely HIV. Contact tracing has been instrumental in slowing the progress of HIV and other STDs as well. I mean, that's still going on, contact tracing. And then TB, and very recently measles and mumps in our state and in our country. So this is not a new process. It's a tried and true process, and it's very successful when people cooperate. I don't know why we're seeing such a low level of cooperation right now. Maybe it is because people are afraid, but I think if we can educate them and let them know that no one's going to get this information, and that, you know, the process is voluntary, but that it is, I mean, at some point you have to take responsibility for stopping this pandemic, or we're never going to get back to normal.
If someone is identified as a contact to an infected person, are they legally required to do anything? Quarantine, provide notification, anything of those sorts?
They are not legally required right now. It's voluntary. I mean, you know, that's how our country works. We give you the option to do that in this case, but no, they are not required to do anything. They don't ever have to tell anybody that they were even called. I hope that doesn't happen. I hope they take it seriously, and many people do take it seriously, but no one's going to be knocking on your door making sure you're not doing what you're supposed to be doing. I mean, that was different with HIV, because with HIV, that was a death sentence, you know, back in the 1980s. And so if you knowingly exposed someone to HIV, that became a criminal situation, and people were sent to jail for spreading HIV knowingly. We're certainly not at that with COVID, but it's not an unprecedented idea.
Do you think that the current coronavirus pandemic creates an unusual, perhaps challenging situation for those in business, perhaps HR professionals that are trying to be respective of HIPAA regulations and personal privacy, yet they are, you know, perhaps notified that one employee is ill and they want to prevent the rest of the staff from being infected?
So what they have to do is, I mean, they really, they have to notify the close contacts. I mean, that's just ethically responsible. They don't have to say who that contact was. We're kind of looking at that in academia too, in my world, where what if we have a student who tests positive? We're being told that we will not be notified that there is a student in our class that has tested positive unless we are a close contact. And it, you know, the CDC guidelines define close contacts as within 6 feet of the person for greater than 15 minutes. Well, our guidelines in the classroom for the fall are we can't be closer than 6 feet to anybody. So therefore, we shouldn't ever be a close contact to our students. But they are protected by HIPAA as well. And so we won't, I mean, we might speculate that if a student is not in our class for 2 weeks, that maybe that might be why, but the college can't tell us why.
Unfortunately,
and HR and businesses is the same way.
So unfortunately, we are out of time. Kristen Cronin, thank you very much for joining us today.
Yeah, thank you.